Hello, Facebook. I am Dr. Myla Bennett of Adara Plastic Surgery and Medical Spa in Johns Creek, Georgia. Sorry, I'm trying to share this to my other pages so we can get more people on. Good afternoon. I want to say happy Sunday, but it's not really all that happy. This is not a good topic, and I don't go live and talk about every time I hear about someone died, but I felt really moved to share this woman's story. Her sister reached out to me. Actually, a couple days ago, one of my other followers reached out and said, someone else died. So people always like DM me when something bad happens. And so Friday night, someone DM'd me. I didn't see it until Saturday, and told me that another person died, but she didn't have many details, and she didn't know much, but she said she saw it inside of one of the groups she's in. And I'm like, who? Like what happened? Where was it? And so she tried to go back into the group to find it, and it was deleted. But she found a post from one of the girl's friends, her surgery sister, which I didn't know what that meant till today. And her surgery sister on her page, it was basically saying like goodbye to her friend, and they both went to get surgery together, and she survived and her friend did not. So she sent me that picture, so I got the girl's first name. The lady's, it's a woman. It's not a girl. She's 45 years old. Her first name. But that was all I had, and I didn't, I won't say I didn't think much of it. I was sad, but that was kind of all I got. So at 1:30 today, another person DM'd me, and I think she might have even did it yesterday. I just saw it. No, it was 1:30 today. It was 1:30 today, and I saw it at like 3. What time is it? 3:50. Yeah, about 3 o'clock. And she said my sister died on June 7th. She had surgery on June 2nd, and she died on June 7th. And I responded back, and I said, what happened? And she gave me her number and asked me to call her, and I called her. And I spoke with her about everything that happened, and she shared with me her sister's name. And her sister, her name is Alicia Renette Williams. And she's a mother. She has a 14-year-old son. She is a teacher. She lived in Birmingham, Alabama. And she was a teacher at Huffman High School. She taught English. She got her bachelor's from Jacksonville State. And then she went on and got her master's degree in English. She was really active in her church. She went to New Beginnings Christian Church. And she was very active in her church. And her sister said that she loved fashion, and she was a diva. And she was a really creative person, and she loved her students, and her students loved her. And then her son got on the phone, and he said that he wanted everyone to know that his mother was a social butterfly, and she was a great cook, and she was very loving, and his favorite thing she made for him was red velvet cake. She's not a doll. She's a woman, and she's not here. And her sister told me that she and Alicia would watch my videos, and Alicia would engage on my videos and ask me questions. And I feel like a failure, because as much as I talk about how to be safe, she still went there and did something that wasn't safe, and now she's gone. And her family's trying to get her body back into the United States. And she hasn't even spoken with the doctor. So she said what happened was her sister went for liposuction of her arms, lipo 360, a tummy tuck, and a Brazilian butt lift. Her sister was anemic before surgery, and that was known information. And apparently there was a lot of surgeries planned for that day, and hers didn't happen until 6 p.m. on Monday evening. And she came out of surgery okay. Well, she survived surgery, went to the recovery home, and her sister had communication with her and her, what she called her U.S. nurse, which apparently the U.S. nurse is the person who kind of ran the surgery group that she was in, that helped connect her with the doctor that she ended up going to. And so she had communication with them via WhatsApp on Monday night after the surgery. She talked to her sister on Tuesday. On Wednesday, when she tried to talk to her, her sister was like, I'm too weak to talk, so I'm going to call you back. By Thursday, she looked so bad that they were like, you need to go to the hospital. They took her to the hospital Thursday evening, and her sister said that they sedated her to give her IV fluids and blood, and she died at 6:30 in the morning on Friday. So she died Friday morning. Surgery was Monday. She died Friday. And now she hasn't talked to the doctor. But the doctor got a message through her, like this was the only death he had. He said that he would pay to have her body shipped back here. She's trying to work through the embassy to get her body back into the United States. They have to do an autopsy first and embalm her before they bring her back. So she has to wait on that. So she says it will be 10 to 15 days before it happens, before they can get her back home. And her sister's gone. She's not here. She's gone. For too much surgery. So I talk about this a lot, like, and a lot of reasons why people are drawn to go to, one of the reasons that people are drawn to go to places abroad to have surgery is because of the lack of regulations on how much blood and like how much liposuction can be done in one setting, and people can get more extreme results in one surgery there. And I don't know if that was her motivation. I don't know. I'm not really sure what her motivation was to go, but that was a lot of surgery to happen all at one time. And she was anemic, so she probably lost a lot of blood, which is why she was saying she was weak on Wednesday. And her body was trying to compensate for as long as it could, and by the time they took her to the hospital, it was too late to do anything. She passed. So a lot of times people will keep looking until they find somebody to do exactly what they're asking for. No, this is not the person who died in Miami. She didn't go to Miami. She went to the Dominican Republic. This kind of thing happens in Miami too. Probably happens in other places, but those are the two places you hear about it the most, like these extreme, when you do too much at once, I don't care, like there's only so much blood in your body. And if you lose too much of it, that's not compatible with life. So they're going to send her back. Probably on her death certificate is going to say cardiac arrest, which means absolutely nothing, because the definition of death is cardiac arrest. Cardiac means heart, arrest means stops. The definition of death is your heart stopping. So she's probably not going to get very much information from the death certificate. I don't know, that's it. Like she died. That's the end. She's not a doll is all I can keep saying. I just wish people would stop looking at plastic surgery like it's a hobby or like some sort of a creative activity, or like, you're not real and you're trying to get this body like you're not a person. I think people need to treat plastic surgery with a lot more care, because women are dying left and right, and it's ridiculous and sad. And I personally feel like I'm failing, because all I'm trying to do is get people to not die. And when I found out that the woman actually watches my videos, it just did something to me. Like, it just literally broke my heart. Like, I started crying on the phone. What I'm trying so hard just to get people to understand, you don't have to die. I just feel like I failed. She's right in Birmingham, Alabama. All of my family's in Birmingham, Alabama. She's from Atlanta, and she lives in Alabama and teaches at this high school there. So now all those kids are, the school is not going to be the same. All of her students are going to be heartbroken. And her legacy is that she died from part of her legacy, not her whole legacy. But she died getting a BBL. I just feel sad. Like, that's probably not even the right word. It's just, How about you don't go to the Dominican Republic? It's not like it matters. Like, so many people, the lady that I interviewed before, who had her bad infection from the Dominican Republic that had cleared up, is back. Like, stop. It's not a good place to go for surgery. It's just not. It's not safe. Even if you live, you can get complications that will plague you for years, or things that you can never get rid of. Like, that's the wrong question. Just like when people will say, well, how much fat will you remove at once? That's a question. That's when people ask me that, what I hear is, are you willing to kill me? Because you're going to keep asking until you find somebody who's going to take off whatever you ask, and that might be something that's going to kill you. Like, the line of questioning is just like, that question was just, it don't even matter. She went to a person, this surgeon didn't have any deaths before, but he knew, and she probably had an inkling that was too much surgery to have all at one time. That was the problem. She didn't get it don't sound like she had a fat embolism. She probably would have died sooner if it was that. Probably. She probably lost too much blood, especially in light of the fact that she was kind of anemic to begin with. So the question is, how do I be safe? Because it's up to you. At this point, we have some renegade plastic surgeons and renegade physicians pretending to be surgeons who do whatever you ask them to do. So if you don't have an inkling of what's safe and reasonable, you could end up dead too. It doesn't matter which doctor it is. So I'm not saying his name. It's a him though. I'm not saying his name. She had liposuction of her arms, liposuction of her abdomen, sides, and back, fat transferred to her butt and hips. That's what she had done. So just like when I have patients and I'm like, yeah, well, that's going to be 2 surgeries, or that might be 3 surgeries, depending on what you have going on. If you've lost a bunch of weight and you got skin hanging in a lot of different places, and you need lipo and you need skin excision of your arms and your belly and your thighs, I'm not doing that all at one time. And when people are, they'll be upset, and I just sit there and I take the time to talk to them, and I'm like, listen, I just canceled somebody this week, the day before her surgery, when her labs and stuff finally came in and her clearance finally came from her doctor, and it was barely a clearance, and she had major issues metabolically, and I was like, yeah, we can't do this. And she came into the office, and I sat down with her myself. I didn't have my staff tell her, and I'm like, listen, this is not safe. We can't do this. And it was, a lot of money. And I was like, I refunded her right before every single penny, even her deposit. I gave it all back because I'm like, listen, I will not help you kill yourself. You might be able to find somebody else to do it. But I sat there long enough to explain to her why I thought it was deadly to do surgery on her right now in this setting, so that at least my job, instead of me just saying, no, I'm canceling your surgery, here's your money back, and going on about my business, so that she can go into somebody else's office and get her and let them hurt her. I tried to explain to her why I thought it was a deadly thing for her to get plastic surgery, and right now in this setting, and so that she wouldn't do that. And that's the best that I could do. And I gave her all of her money back, and she left with an attitude. I mean, I'd rather somebody be mad at me and be alive to be mad than oops, and she's dead next because she really, really wanted it. Like, that's not, as surgeons, we're supposed to be responsible and do the right thing. But the problem is that all of these surgeons aren't doing the right thing. And some of these people aren't even surgeons. So, you have to be responsible for yourself. Like, everybody always wants to go pointing the finger and blaming somebody else. But people know, like, when I'm like, we're going to have to do it, I was scared you was going to say that. Why are you scared I'm going to say that? You should be glad I said that. Like, you should be happy that I'm not willing to murder you for $10,000. It's just, it's extremely unfortunate. Like, I'm just really bummed about the whole thing. So I'm going to go back and see some of these comments because I wasn't paying attention. You all, if you haven't done it already, could you share the video? And let's try to get the word out. And prayers out to Alicia Renette Williams' family. Prayers out to the students at Huffman High School in Birmingham, Alabama. Prayers out to the members of New Beginning Christian Church in Birmingham. Prayers out to her sister, her son, her friends, and everybody who loves her. You know, that's it. So Stephanie Preston said, oh my God, you have to do your homework. So she did all the homework that everyone else does. She was watching videos. She was looking at before and after pictures. Her surgeon actually hadn't had any deaths. At least that's what he said. I mean, you know, hopefully that's true. Maybe it's not. I have no idea. But you have to not be... I don't know that she was desperate. I don't know if that's the space she was in as far as wanting the body so bad. But I spoke about this on a recent video, that those groups, they just the whole culture within those groups is set up to kind of get you kind of locked in and you don't even realize it. It's so like insidious and slick. And you know, if you just think about it, most of us are on our phones for a significant portion of our day at some point, on social media, scrolling through in a timeline on Facebook, Instagram, snaps on Snapchat, whatever, you know, new fresh videos on YouTube, whatever. But the group specifically is kind of like a bubble, right? So you're in this group and everybody in the group has the commonality of wanting plastic surgery or having had it, okay? And leading up to people's surgeries, they're posting about, you know, everything about their surgery. Oh, do I think I need a walker? Where'd you get your walker from for after your tummy tuck? I just bought my recliner. Oh, I just got all of my stuff. Oh, I just got my passport for my trip to the Dominican Republic. Oh, I just got my this, I got my that. So every day you're seeing this stuff about people building up to their surgeries, and then they'll take a picture of themselves in the pre-op area like, it's surgery day, you know, pray for me, blah, blah. And then they'll post a picture of them like, after surgery, you know, you can see their drains and their stomach's flat. You know, they take that picture like this where you can see their stomach is flat. I'm on the flat side. And then, you know, a few weeks later, they'll post a picture in like some cute underwear or a swimsuit or their jeans with their stomach out or whatever, looking really good. And you're like, whoa, I can't wait till I get my surgery. Because you're seeing this stuff constantly every single day. And then, you know, these women's bodies look nice, you know, and you want your body like that. And then you go pulling up your pants and you can't get them up, or you can't put on nothing without having on all kind of garments and stuff to squeeze stuff. And you keep seeing this stuff and you want it. It builds like a sense of urgency and desperation inside of you just from the imagery that's coming through your timeline every day and going straight into your eyes and hitting your brain. You don't even realize it, how you easily can start to become obsessed with it. Now, if you couple that with lack of financial means, and let's say you say, you know what, I'm going to not go somewhere that's not safe. I'm going to try to go somewhere here. And then you go in a consultation with a doctor in the United States, and they're like, oh, all that stuff. You say all of this stuff to a doctor in the United States, with the exception of some of the places in Miami, but everywhere else, all of these things that she got, you're looking at $20,000 or something or more. And if you're in LA, you know, that might be $40,000, all of that stuff. And then you're like, shoot, I'll never have the money for that. So then you're continuing to see the stuff in these groups, and you continue to see person after person where stuff comes out great. You know why? Because just like what happened to this girl, when somebody posted inside of the group that she died, by the time the person who told me about it went back to try to see what happened, they had took the post down. They don't want you to see that. The people who run those groups don't want you to see that. They don't want you to see that somebody just died. They don't want that. And then people assume that every time a person dies, it hits the news. This girl, her death wasn't on the news. Did you guys see anything on the news about her death? And it's definitely real. I just talked to her sister. She died, and it wasn't on the news. Everything that happens is not on the news. You know that, right? So they delete it quickly out of the group so that you don't see it, because they're not trying to poison the whole group with death. Somebody gets a complication. The girl who I interviewed a few weeks ago, when she had her complication and she put it in the group, they threw her out the group. They threw her out the group. She had to go find a wound group where you're allowed to talk about your wounds because that's what the group is about. But by the time you get to the wound group, it's too late. You already did it. The images you're being it's like it's a biased representation of what's going on. So you keep seeing all this good stuff. Well, it worked for them, so it's gonna work for me. But there's no. So she went there with her surgery sister, which apparently is somebody she met in the group. They connected. They decided they were gonna go together for their surgery. So of the 2 people who went, 1 person came back alive, and the other one did not. And there's no way to know which one you're going to be until it has already happened. And the sad thing is she's not feeling the pain because she's dead. Her family and her son, they're the ones feeling the pain. She's gone. Everybody else is left to feel the pain. That boy don't have a mother. He doesn't have a mother. So homework, that came from do your homework. Like that, like the whole do your research and all that stuff is like, use your common sense is probably more appropriate. It sounds like too much to do at once. But folks like, well, so-and-so, and then when you have people, and I'm sure there'll be people on my video making comments like, well, I went there and I came out fine. So did her friend, but she came out dead. Quit saying that crap because you helping people get hurt. You got lucky. You play Russian roulette and got lucky. Yes, wrap your arms around her family. I so agree, Latrika Edwards. Am I talking about Sarah? No, the person that died, her name is not Sarah. So someone named Sarah died too? You see what I'm saying, y'all? It's so many women dying. Like, and when I did that video and I was talking about the flight attendant who told me about how they bring bodies back all the time on her, when she flies on her particular airline, is 3 or 4 coffins brought back a month. And I said, that's just the flights that she's on and with her airline. And it was all kind of people trying to act like I was making it up or something. Like, what benefit do I have to making that up? Even if you think about it, what is the benefit of me talking about people dying in plastic surgery when I'm a plastic surgeon? Like, obviously, that's going to deter people from getting plastic surgery. I'm not worried about financial gain when I do these videos, because these videos technically could do the opposite of that for my business. I don't want people to die. Like, don't sit on here and try to fight me about stuff. I just deliver information that I get to help people, like, kind of try to snap out of it or realize how certain things are brainwashing them so that they live to be mad at me, but be alive. That's all I care about. It's a lot of comments. Oh, they closed Dr. Cabral's office. It wasn't Dr. Cabral. I can't say that. It wasn't him. There's so many comments. Okay. Sorry, y'all. I'm having a hard time with my phone. All right. I'm not saying I was supposed to go on tonight and talk about drainless tummy tucks, but I'm going to do it tomorrow because it just don't feel right to do that. I'm going to let this day be like go to her memory. I'm not going to talk about plastic surgery tonight. All right. I guess I'm going to go ahead on and get off. I don't see any other questions it's just comments. So, if you haven't already, please share the video. Just be smart. Don't be desperate. If you can't afford it, don't get it. Don't get too much surgery at once. Like, just, if it takes more than one surgery to get to your goal, then that's how you need to do it. And, you know, don't play Russian roulette with your life. That's pretty much all I can say. So I'm going to go ahead and sign off. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. If you want to reach out to me, you can do so via my website at www.adarabella.com, or you can call my office during business hours. Phone number there is 678-325-0006. All right. Rest in peace, Alicia Renette Williams.